name is Jackie Kennedy, but everyone calls me Jax. I have a personal health budget, which I've had for 2 years, and I'm here to show that personal health budgets are the future of the NHS. They actually save hundreds of thousands of pounds, and myself and Kingston are evidence of that. So my personal health budget has put me in the driving seat of my care. I choose how to spend my money, because so far in 3 years he's saved £837,000 for the NHS. So my budget is to get me better, but it's also to show those people that are in charge of the finances there's nothing to be scared about. PHBs are going to give us an NHS that will be there for future generations. Prior to having a PHB, I was socially isolated. I was bouncing left and right to hospital and different clinics and my GP. I could be at my GP, 4 or 5 times a week. Since having a PHB, I'm independent. I travel all over the country, speaking at conferences. My health, both physically and mentally, is improved because I'm working in conjunction with my professionals. They're not saying to me, you're going to have this treatment. I look at the treatment I want. As long as I've got a good outcome and I can evidence that, I'd rather have something like a deep tissue massage than years and years and years of antispasmodic tablets, which cost, again, the NHS loads of money. So it's made me an advocate for my own care. So I'm looking at how I improve my own care. And I love nothing better than trying to see how I can do things differently, evidence those, so that I can then go and say, I don't need that amount of money now, I can do it for this. So that's been a massive thing for us, is showing that it's not just a dog. It's looking outside the box creatively. You can save tens of thousands of pounds for each person, because there is that misconception that if you give someone a pot of money, they're going to waste it. We don't, we actually stretch it out. So Kingston will help me get up in the morning, he'll help pick my clothes, he helps me in the shower, helps me come out of the shower. Once we're dressed, he gets fed and toileted. Then he helps me pack my wheelchair for what we need that day. Then we head off, and we could be working solidly for 14 hours. And during that 14 hours, if I need anything, if I drop anything, Kingston will bring it back. He'll help me get undressed if I'm too hot. If I need some water, I can let him off. He'll go and bring me back a bottle of water. Medically, he keeps an then me. So he will let me know if my blood sugar goes too high or too low. Also, if I'm going to have an epileptic seizure, he'll know 45 minutes before. So it then means I can travel independently. I don't need a human PA to come with me. I often stay over at conferences at the hotels. And, last year we was at a hotel and a fire alarm went off at 5 o'clock in the morning. Within seconds, Kingston had me in my wheelchair, my clothes on my lap, and opened the door and we were out. If I'd been on my own or with a human PA in another room, we don't know what would have happened. But he is more than just a dog. He's absolutely saved my life 10 times now in 4 years. So without Kingston, I physically wouldn't be here. And thanks to my personal health budget, I can afford to have Kingston. Because he's come from a charity, I would normally be responsible for his insurance, his food and everything else. And as a person with disabilities, the money I get goes on the things I need for home. So I had to weigh up, do I send him back to the charity or do I look at a way of funding him? And thankfully the NHS have seen what he can do and they're quite happy to continue funding him. When people meet Kingston and they hear our story, then they can see the evidence. Be creative, think outside the box, give something a try. 3 months, 6 months. If it doesn't work, then there's not a lot lost. If it works, there's a hell of a lot saved.